we as a group have advocated for Gosnold because we wanted all the different opportunities and availability and what they have to offer as far as accessibility to programs that we don't have through any other program here. And I just want an honest answer, because since we heard they were coming, we've been their advocates.
Yeah.
And now I really want to know where we stand as a community with their long-term plan for Nantucket.
It may be that they're pulling out. They've had trouble keeping people in that office.
You know, that's my concern. So I would rather know what the real reason why they're pulling this grant is.
Yeah.
Because in a time like this, when you don't have staff and people are really hurting, it seems that pulling a grant doesn't really go with the flow of what's going on in the community. So
No, it's a red flag.
yeah, it's a big red flag. So I wrote to them and have told them that until I hear differently, I'm not sorry. Woo, I'm not, I'm waiting on their pulling of the grant. I want an answer. Brooke?
Do they have any outstanding contracts with the town?
No, I just said this was the first contract they've ever asked us for. So what bothered me was when she said, well, we were pulling all town grants from any town. And I said, well, that's funny because this is the first grant you've ever written to Nantucket. So how can you be pulling, you know, like across the board?
They may be pulling
Answers
grants
didn't
from
make
other
sense to
towns.
me, to my questions.
But they may be pulling grants from other towns that they've done this with.
They could be, but you should know that this is the first time you've ever had a grant, and you should know who your director is here, right?
Yeah.
And they said the only contract they have right now is a contract with Dr. Lepre, and he's a contracted employee of Gosnold right now. So I just wanted to let everybody know that I have a little bit concerns, and when I get an answer, I will let everybody know in writing what we've heard, okay, through Ann. Okay? Brooke?
Just one other quick thing. As of a few weeks ago, they had committed to participating in the Council for Human Services Community Forum in January. So this must be good new news. It's weird.
Yeah, I mean, I think that they could still be participating as an outreach program, but are they offering services? What is their long-term? I mean, we've had it before where we've had organizations come forward to us and present something, and 2 weeks later we hear they disappeared. You know, so I just think that I feel it's only fair that we all have an honest answer and that the town actually know what's going on with Gosnold. Okay. Anybody have any questions on that, Brooke?
Dorothy, I just have a procedural question. I had emailed you this morning that I was thinking was going to duck out, but if I duck out, we don't have a quorum, right? So I need to stay.
Correct.
Okay, so I'll just let the people that I was going to meet with know that I won't be able to join them.
Okay. Sounds good. It looks like, of course, they're early because they're always early. It looks like we have health imperatives sitting in our waiting room, or they're maybe here. So we're going to just start with them. Okay, everybody?
Okay.
Hello, Jennifer.
Hi.
Hello.
Hi.
How are you guys?
Good. How are you?
Good. We're trying to both be on at the same time while social distancing.
Okay. Good luck. So I'm going to have everybody introduce themselves because we have a couple of new board members. Okay.
Great.
And first, you two, I want you two to introduce yourselves, and then we'll have them introduce themselves. Okay.
Oh, okay. Jennifer.
Okay, I'm Jennifer Allison. I'm the Vice President of Development and Community Relations at Health Imperatives.
And the author of the application. I'm Julia Keogh. I'm the CEO of Health Imperatives, and I just want to thank you all so much for all of your support over the years, and I hope you're all doing well.
Thank you. Okay. Hey, Bert, we're going to start with you today so I don't forget you.
Bert Johnson, the representative from the Nantucket Planning and Economic Development Commission.
Linda.
I'm here.
Yeah, can you introduce yourself?
Linda Williams, member.
Okay, Brooke.
Okay.
Hi, I'm Brooke Moore, and I chair the Nantucket Council for Human Services.
Hi, Brooke. Hi.
Jill.
Hi, I'm Jill Veith, and I'm on the Finance Committee.
Great.
Rachel.
I'm Rachel Day, one of the assistant town managers. I'm participating. I used to be many years ago, actually not that many, the council, the human services director. And so we do have a new one that you'll hear from shortly, but I'm also assisting in the interim because one, I'm interested in CRC and the efforts that are done on this group, but also because we do have a lot of COVID-related fun things for our HS director to do that might pull him away, and I'm trying to help him as best I can.
Okay, and Jericho.
I'm Jericho Mealy. I'm the Director of Human Services she just mentioned. So yeah, I'm sitting in on this to try and get on top of the CRC thing and figure out what everyone's doing. Thank you.
Great.
I see that John Balash has joined us. Ann? John?
Yep. Yes, I'm here. Wait a minute. I couldn't go on the link, so I had to go around through Zoom.
Okay. There he is.
That's why I'm late.
Hi, John. We're just in introductions, John.
All right.
So could you just tell everybody who you are?
Oh, I'm John Balash. I'm a member at large of the committee. I'm a retired lawyer.
Okay, and then I just see that Sunny joined us, so.
Hi, Sunny.
Hello. Hi, I'm Sunny Daly. I'm the Director of Health Imperatives here locally on Nantucket.
Okay, fabulous. So as with Sunny, so I've noticed that you see we have Jill Veith. She is a new member via the FinCom. And we have Brooke Moore. She's Human Services. She's the chair of the Council for Human Services. As with every year, can you guys give us, first of all, personally for me, very nicely written report. So if you could please present to us, and then we'll ask questions.
Okay. I'll go ahead and start. So the focus of our application is three major components of the services that we provide at Health Imperatives Nantucket. First of all, our sexual and reproductive health services, which encompass quite a few specific services, including birth control, pregnancy tests, tests for sexually transmitted infections, including HIV tests and hepatitis C tests. We also provide HIV prevention medications, gender-affirming hormone therapy, and annual exams, cancer screenings. So these services are in high demand. As you can see from the first portion of our proposal, we've served an increasing number of people over the last few years. And even in the midst of the COVID-19 pandemic, we've seen numbers continue to increase. And then the second portion of our application is our Wic Nutrition Program. We've also seen a high demand for that service, especially during the pandemic. That program encompasses nutrition assistance, so benefits to allow low-income families to purchase supplemental healthy foods like milk, eggs, cheese, grains, fruits, and vegetables. And it also includes, I think, a particularly unique component of this program is it provides nutrition counseling and education. And we've really built out that piece of the program in particular, especially and even in the midst of the pandemic. We've been providing workshops. Our Wic nutritionist has been doing that online using Zoom. And I think that that work has been particularly successful. And then another component of the Wic program is Breastfeeding Support, and the Breastfeeding Support group that we conduct has been taken online since we're not able to do that in person, of course. And then the program also provides a variety of referrals to community resources ranging from transportation, childcare, fuel assistance, housing, any number of different services that clients might need. So it's, as you can see, it as well as our sexual and reproductive health services, the Wic Nutrition services are very comprehensive. And then the third component of our application is education and outreach activities. So these include workshops, parent education workshops, for example, childbirth education classes that happen periodically, Happiest Baby, and breastfeeding classes that also are conducted periodically, and then participation in a wide range of community activities, most of which, virtually all of which at this point have been taken online, but they include participation in the ACT Teen group to engage teams to build leadership skills, to help improve nutrition and health. And there are numerous additional community outreach efforts that we engage in, partnerships with, at this point, 29 different organizations and groups and programs on the island to help people improve their health, to help improve their overall well-being, and to, of course, connect them to our services and to the services of other organizations on the island. So in a nutshell, that those three components are the focus of our request.
Okay. Anything else that you want to add to that, Sunny or Julie?
Sunny? Oh,
I'm here. Yeah,
okay.
I think Jennifer summed up very nicely the programs and the focus of those programs. I'm sort of the person on the ground on Nantucket that tries to pull the threads together. And as you can imagine, COVID-19 has presented its own set of hurdles. I feel that we have been very outside the box in the way that we've approached how to overcome those hurdles. I think in particular, I'm very proud of the work we've done with the teens. I can only imagine that they are zoomed to their eyebrows and then some with school being online, but they've been very engaged. I feel like we've really been able to bring some of these programs that would be very beneficial to teens into their world in a way that they are excited and engaged in. So I'm very proud of that work in particular this year.
Great. Thanks, Sunny. Yes, Sunny's on the ground doing all the great work. I just wanted to add that over the years, you know, since we started this, it's your support and the support of other funders on island has really allowed us to develop this model that before we were primarily providing off-site services from the Cape. And we've found that obviously not only are we able to serve more people, but more people more effectively. And also Sunny has done a fantastic job of connecting with other providers, which has allowed us to coordinate the services better for people on island. And we're absolutely committed to doing that regardless of what the funding picture looks like going forward. I think this year, you know, we were receiving significant funding over the last few years from Healthy Nantucket 2020, and that has sort of transitioned. But this year we were able to receive over $100,000 from the Nantucket Emergency Fund, which has allowed us to keep especially the WIC piece going. We did receive cuts from the state that we're hoping will be restored, that will help us, but we had to make a couple of, you know, changes to the way we were doing things. One was our young parent program component, you know, was the smallest piece, and we really didn't have the capacity to continue that as we would have liked to. But I think that a lot of that work was being done remotely anyway. And now because of the work we're doing remotely, with the teens, for example, and through other partnerships, we're still able to leverage or provide support to young families. And then the other big issue was, I know in the last application, we had asked for funding to help move. We've gone through lots of work to move, but the funding just wasn't there. And so we're still aware that over time that we're going to need to find a new space, and we're prepared to, continue to fundraise and do all of that. But right now, because the costs of doing business and the increasing costs of healthcare, and most of the time the state and federal funds are flat, which essentially is like getting a cut year after year if you're trying to do the same level of services. We're really not in a position to like add that expense on. Having said that, since Jennifer's been here in just 2 years, we've doubled our organizational fundraising from around 400 to this year so far. We've already raised 800,000, and we're only halfway through our fiscal year. So I always use Nantucket as an example, and it started with the town, and then we were able to expand with other funders as a way of really leveraging local, municipal, state, federal, and private funding to really address the particular community needs. And we're still absolutely committed to advocating for funding changes at the state level around Nantucket. It's still, I've said this probably every year, our top priority in terms of healthcare access, given sort of the rural nature, the isolation, and the extraordinary high proportion of uninsured individuals we're seeing. We still have we have 7 clinics throughout Southeastern Mass, including Nantucket, Martha's Vineyard, Hyannis, Wareham, New Bedford, Brockton, and Plymouth. And for those of you who are new, I say this to everyone else all the time, but you think because the health disparities are so great in Brockton and New Bedford, and they're regularly in the top 10 of certain poor health indicators, that would be our #1 priority. And we're committed to every single community, but Nantucket has the greatest disparity of wealth and poverty. And in that, there aren't other providers providing the kind of services that we provide on island. And so that's why we see about 60% of all the people we serve do not have insurance. The state average is 3%, right? And our clinics are between 40 and 60%, because we particularly have made a decision to seek out and provide services to people who otherwise would not get health services. So just to put that, I want, I don't know what the future is going to be with state funding next year. The final budget just came out for fiscal 21, which started in July. They've been doing just 1/12 funding at a time. And so now we were bracing for massive cuts, but we did not get them. But effective July 1, the sort of common thinking is that there may be significant cuts. So we're bracing, we're trying to bring in as much fundraising so that we can have a little cushion year to year. We're doing better than we thought this year so far in terms of the number of people seen and the revenue. But next year, which this funding will cover, is all up in the air. So I just wanted to say that while we may not access the same level of support that we've gotten over the years to support the model as is, we're going to do everything in our power to fund it. And then if we have to make changes, to make them in a minimal way that won't undercut the sort of basic value of this incredible model.
Thanks. Sunny, can you just answer one question before we move on to the other questions? Could you please tell us again what the youth programs are that you're doing?
Sure. So the newest addition is ACT Teens, and that's a collaboration between several nonprofits and the teens at the high school. So that is ASAP, which has merged with NAMI. Mm-hmm. It is the Boys and Girls Club, the community school, Fairwinds, and ourselves. And we've come together as a group of adults we started back in the spring and sort of said to the teens, what kind of programming would be interesting to you? Because oftentimes it's us talking to the teens saying, this is what you should be interested in. And half the time they are, and the other half they're not. So from that meeting, we were able to find a lot of different avenues that the students were interested in pursuing. And then with the school reopening this fall, we sort of had this stutter stop approach to what we could actually implement. And now that the school is completely remote, we still have this group of teens that we're in communication with on a bi-weekly basis. And the programs that we've been able to get off the ground, the first one is a mentoring program between high school and middle school students, where we're pairing them together and sort of developing that support for the younger students, developing like what are they interested in? How do you get from what you're interested in to what you could either take on as a high school student, whether that's an after school club or you're interested in, we've had a lot of interest in town government, nonprofit work. What does college look like? What do trade schools look like? So all of those conversations are beginning to happen with students that are middle school coming into high school. So that program's been up and running. And then we are trying to get off the ground a health and wellness program that was supposed to start this month, but then with the closure of the school, we've pushed it off to December. And this one's really exciting because it has a physical health, but then also every class is built in emotional health and sexual health. So the kids would have a workout, and then they would also talk about physical health or emotional health and sexual health as part of that. So that program is going to start in January, and we're partnering with Isaiah Club, which has a private club, and then Fair Winds will do the emotional component, and then we'll do the sexual health component. So that's taking off. And then we're also going to do, which I'm super excited about, a remote cooking class. And this is another one of those like great partnerships that's come together, where Alice, who's the nutritionist for Wic, is going to teach live on Zoom a cooking class, and the kids will have signed up in advance. So not only will they get the recipe, but they'll get all the food for the class as well. So the idea is that they would be cooking a meal for their family with Alice as she's cooking it. And then when they're done, everybody's fed. And that was a big lift. There were a lot of partners involved in that. And I just think it's going to be great. I mean, I kind of threw it out to my staff and they were like, how do I sign my kids up? Because I get dinner out of this. That's amazing. So yeah, that program has really taken off, and I'm really excited about that. So that's what our team programming looks like right now in the age of COVID. We hope that, some of the other programs will take off, but it's just been really interesting path to try and get students to engage when so much of their life is already online.
Okay, thank you. Okay, anything else you three want to add into us before we start questions?
I think that's good for now.
Okay. Bert, I'm going to start with you.
I don't have any questions. I just congratulate them on the job they keep doing.
Thank you.
Thank you so much.
Okay, Jill.
Hi. So I've been, thank you so much. I mean, this is a really detailed write-up, and I appreciate all the information that goes into this, because I know that's not easy. It's very specific. Can you talk to me a little bit more about the WIC program? I guess I always thought that was a federally funded program. So is it a local matching grant or something? And forgive my ignorance.
Sure. Yeah, it is federally and state funded program. And what happened, the way they fund it is based just on population and doesn't take into account anything like the fact that you're really small. There's no ceiling. So, or no floor for funding. So what that meant for Nantucket was there wasn't enough funding to provide WIC on island with just the state and federal money. So we were sending people over from the Cape to do it just a couple times a week. So when we came to the town, we said, if we had additional funding to be able to, first it was to have Sunny be full-time, because we didn't have any full-time staff on the island because all of the programs only had so much money and it didn't rise to the level of a full-time staff person. So first Sunny was sort of overseeing all programs. And then when we were able to apply for funding through Nantucket 2020, our pitch was, let us hire a Nantucket nutritionist with the private funds to do WIC. So we went to the state and said, we want them to be trained by WIC and, actual WIC employee, but we're getting funding from the Community Foundation or Healthy 2020 to do it, because the mechanism from the federal and state government doesn't allow us to have on-island presence, and it's a health disparity issue. And we looked at all of the guidance around, like, how many people in each community are eligible, and of that group, how many are actually getting WIC. And it was the lowest, of course, were on Martha's Vineyard and Nantucket because of the island and the fact that we're not providing services on island. And also, the big thing when we first came to the town many years ago to pitch this was that all of those federal dollars, so there's the money for the administrative part that I'm talking about that isn't sufficient, but then the benefits themselves there's no limit to. So if we signed everybody up who is eligible on Nantucket, that money going to those clients for the food that Jennifer mentioned would be there, right? And it would be spent in Nantucket, supermarkets, right? Or yeah. So what we were saying was having this funding to provide for a staff person who would typically be covered by the state and federal funding will bring way more money into Nantucket as well, in terms of, trucking jobs, all that associated with it. I think Moody's says that the economic stimulus for $1 in food stamps is like $1.85 in economic activity. So this is why I was saying it's such an unusual model, because nobody else in the state has this model, because primarily the WIC program is state and federal funded.
So just to follow on that, then just tell me more about how you administer it, like, because it seems like a big group of people, right? So you're involved with the school directly with it, but then you're also I see that it's, breastfeeding and postpartum and things like that. So actually, I don't even know where you all meet, so forgive me. I'm just trying I'm very visual.
Yeah, so the WIC program itself is really more than just the food part. That's, I think, the most obvious piece of it is the benefits that go to healthy food. But there's also a nutrition component. We do everything from, weighing the baby, making sure they're meeting all of their, outcomes and all of that, making sure the mother's healthy during pregnancy and after. And then there's also the breastfeeding component, which is, making sure that people who can are able to breastfeed. So it's a comprehensive sort of public health program. And typically we're still providing the services at the clinic. So we just have that one site. To the extent that we're doing sort of off-site, these nutrition cooking classes and all of that, that's been remote. But the WIC is probably one of the most heavily bureaucratic programs, government programs. So it's very specific, like what you can do, what you can't do. So you have to have 2 people doing this, that, and the other. It's really one of the challenges, I think, for us reaching people across the board is because of all of the federal requirements on actually how you administer this program. So for us, one of the sort of silver lining of COVID was that when that came about, the federal government gave the state all of these waivers so that we could do virtually everything remotely, which made it much easier for us to reach people. They didn't have to come in if they were worried about COVID. We had, the capacity to talk to like all of the partnerships that Sunny's developed and make sure that people know about it. So that kind of partnership has allowed us, I think, to really increase, especially in the Spanish speaking communities where we've done a lot of work with the churches and, all of that. So her outreach, having a full-time nutritionist on island I think is really is a really great model that the state is excited about. But I'm hoping that if we don't have adequate funding to maintain it at the level that we have it now, that we can appeal to the state to figure out a way in the next sort of funding round to have some kind of different way of funding the island, because I talk about it every single year. And this past year, it was in November, and we said, you know, the town of Nantucket, the Healthy 2020, the Community Foundation has really been, you know, supporting, but we can't, you know, we can't assume that that's always going to be the case. And so we have to figure out a way for the state to come up with a different formula even for addressing either having a sort of minimum staffing requirement, just to, you know, or coming up with some kind of, I don't know what to call it, but when COVID started, there were, in some cases, we were able to pay like hazard pay. So there's always a way to come up with another, I think, but they haven't figured it out yet, but we're pushing it. And this is very unusual. I don't know that there's another program like this in the country. So.
It sounds very complicated. I sympathize, but I understand. It's Nantucket gets viewed very differently from other places. So that's even true in my own business, which is totally different than what you do. So I sympathize. I understand. Let me ask you about the sexual reproductive health care as well.
Mm-hmm.
So where do those that gets administered at your clinic as well? Is that nurses? Is that doctors? Is that both? Is it maybe social workers? Like, just trying to understand the staffing, and I'm sure you have to tailor it to each need.
Yeah, our model is all of the healthcare is provided by nurse practitioners. We do have a medical doctor as our overall medical director for all 7 clinics, but the actual clinical work is done by nurse practitioners. We also then have, which is unique about this type of program, have, well, medical assistants as well as sexual and reproductive health counselors. So who do the kind of educational support in addition to the actual medical care.
And so on that, it said that there's the gender affirming hormone therapy. Is that new? Has that been around for a long time? Is that something nurses, is this the actual therapy, or is this just the counseling?
No, it's the actual therapy. It's been, Sunny, what, 1.5 years, maybe almost 2 years now?
Almost 2 years, yeah.
We're doing it. And I think this and the PrEP, which is the HIV prevention, and PEP, which is post-exposure, if someone's been assaulted, for example, it's a very short but intensive course of treatment. Those 2 things, that and the gender affirming hormone therapy, came up because of the work we were doing in the community and the gaps we saw in terms of needs for people. And so we were able to bring those on. And I think the gender affirming hormone therapy, even though it affects so far like a relatively small number of people, it's actually, you know, according to our director of sexual and reproductive health, like life-saving, because, you know, people who are, you know, not able to conform to the gender that they are inside, have a much higher incidence of suicide and other poor health outcomes. So yeah, we really are trying to get more, you know, make sure that more people know about that work.
Right. And so do you go into the schools and tell them that, or is this a certain age group, or they just need to know about it? Like, how do you?
Well, it's for 18 and over, but for lots of reasons, but we've made exceptions with the approval of parents and our medical director to make sure if they're under 18 that it makes sense for. So we've done that.
Okay. Yeah, that makes sense. That's why I didn't know if you were like advertising at school or something, or what the age range was. And I think that's really all I have right now. I think I'm good. I just wanted to get a feel for everything that you do, which it's really varied and it takes on a lot. So I really appreciate your grant writing. It's excellent.
See, Jim? Not me, that's Jennifer.
Thank you so much.
Well done, Jennifer. Thank
Okay.
you.
Linda.
As you know, as I've mentioned last year, I've had 3 kids on the WIC program, 2 of them on specialized formula that was like $30 a week. So I'm a big proponent of the WIC program, and you guys have expanded it, and I love that program. I will always love that program. But it's also come a long way for those who were first getting on this commission. Because back in the 70s, we went and got our birth control pills there. But that's it, pretty much. And what it's evolved into now is absolutely spectacular, and it has a real presence in the community. And I'm just very pleased that you guys are doing what you're doing, and you've worked out this cooperative with the other relevant entities. And I'm just thrilled with you guys. I wish you'd ask for more money.
Thanks for the tip.
Thank you.
And thank
Thank you.
you for all you do.
Okay, Brooke. Brooke?
Yep, working on it. My unmute button is a little slow.
Sorry.
Hi, guys. Thank you for a very thorough presentation. I have a few things that I'm curious about. The percentage of people who are uninsured, is that a reflection of our immigration status and their ability to access insurance primarily, do you think?
I think it's threefold, actually. I think the reason why Nantucket is higher than others is I think there's a higher proportion of, for people who, for their immigration status, don't have coverage. But I also think that there are people who are over income for Mass Health, but can't afford their healthcare premiums, and so make that decision to not have coverage and take the penalty. And then the third is that we have a very high proportion across our whole portfolio of people on Mass Health. And I think that, Mass Health is amazing, but it's a large bureaucracy, and people, a lot of it is done sort of remotely through a third-party customer service. They don't have any offices or anything online. And so if someone's family status changes, if they have another child, or they don't submit their annual income, there can be gaps in that public coverage. So one of the things that we've been doing, and Sunny's been doing with staff on Island a bit, is getting people back on insurance if they are eligible. So we're trying to bring that down. But yes, we do really focus on, there really isn't anything else, sort of primary preventive care for people whose immigration status doesn't give them coverage. So that's continuing to be, we want to make sure that the funding that we have to support through the state and the formerly the federal government, the clinical services, that's really for people who can't get insurance, and that those other people that we bring down. But again, that shows how the policy that we learn what's happening on Island, we can bring back to the state, because the state says to us, you have more uninsured people than any other provider in the state. And we say, well, look at the communities that we're serving. And, this issue of people not being able to afford the premium, right, even if they're over income, is particularly an issue on Nantucket, because they use federal income levels to determine, what your eligibility is. And the average cost of living on Nantucket compared to statewide is like 100% higher. So that shows that this is going to be a problem there that wouldn't necessarily be a problem in Brockton.
Yeah, so the income isn't adjusted to area median income. It's
No.
a straight federal calculation. So the other thing that I find interesting, and I'm hoping that the new census will help, because this has been our problem here, is that we are undercounted in terms of our population, and therefore this is a specific example of a program that loses funding because our census is inaccurate.
Right.
And I can only hope that folks did it this time around. And then the question I ask, I have one other thing. How do you work? What are your vehicles for collaboration with other, like ACTEEN? The ACTEEN program obviously came out as a collaboration. What are the vehicles by which you connect and collaborate with other organizations on Nantucket? I'm asking that as a chair of Council for Human Services as a learning question for me. So,
Sunny?
Well, Brooke, I think you probably have an inside track on this because it is kind of the way we've done things on Nantucket for a long time, which is feet on the street and meeting as many people as you can meet them. And I pursue every avenue, whether we think it's relevant or not, because I think human connection is really key to implementing the programming we want to implement. I'm on just about every meeting, committee that I can get myself onto. But I think, really it's the connections that I have with people in the community. They just, the work that I'm doing here, I'm very passionate about. It's very easy for me to incorporate it into everyday conversation. I don't make any assumptions about anyone, or at least I try not to. So the information is given to somebody, whether I personally think it's relevant or not. A lot of the sort of connections that I made came out of the Community Foundation when they have their collaborative luncheon once a month. I've met a lot of folks that way. The Interfaith Council was another collaboration. This ACT Teens came out of a Boys and Girls collaboration, Boys and Girls Club collaboration. The community school has been a huge partner for us. And in fact, they've actually put the WIC announcement into their bulletin, which I'm thrilled about because that's just going to reach a whole nother crew of folks. When the new superintendent came along and the new principal at the high school, I was sending emails introducing myself. So I just tried to make it part of my day-to-day work, is to just make sure people know we're here.
okay, great. And then my last question is, and I ask everybody this, I can see you have multilingual staff members, so I see the commitment to multilingual communication is already there. And so I ask people how they do that. Is there anything else that you do specifically that supports effective communication for folks for whom English is not their primary language?
Yeah, I would say that my staff are my greatest asset. The fact that we're able to converse in English, Spanish, and Portuguese, I think is a huge gift, especially for the communities that we're trying to reach that may be limited to their access in other capacities because of language ability. I am sadly the weakest link in that equation. But I know also that from Health Imperatives standpoint in general, they're committed to providing services in multi-language capacities. So all of our material is available in English, Spanish, and Portuguese. And I think that is huge, to have the support both from what I call headquarters or up in Brockton down to the local level. We're able to get that information out in 3 different languages.
Great. Thank you. That's all I have.
I was just going to add to that. One of our overall sort of strategic sort of priorities, to Sunny's point, is to make sure that our services are not only accessible to people regardless of language or population, but also that we're engaging them as much as possible in the provision of services and in sort of outreach efforts. So our overall goal, if we are able to raise additional funds in the next years or so, is to really deliberately employ community members. So whether it's as peer leaders, or then they start as doing focus groups for us and helping us reach the population and then come on board as employees. But we really want to formalize sort of the ways that we're working with program participants to make the services the most effective to them and reach more people in the community.
Yeah, I would say that one of the things that I think is going to be a priority is fostering the development of people into careers in this area, local Nantucketers, especially bilingual local Nantucketers, in human services careers across the board. And so it's a project that's kind of on the burner for me going forward. So thanks, everybody. Appreciate it.
Brooke, I will say that I agree with you 100%. And part of that teen mentoring program is to help students realize that when they have the ability for multi-languages, that's a huge asset, and helping them realize what that could look like for careers moving forward.
I'm going to have to move this forward and have John, if you have any questions.
I certainly have no questions, but well, you and I have sort of, as starting with a visitation program, we've kind of been on the outside of seeing this grow in effectiveness and the fact of the increase in the ability to cooperate or coordinate. I'm not saying they were always going to cooperate, but be able to coordinate with all of the other organizations is just massively impressive.
Thanks, Sunny.
Okay, I did just a couple of things. First, Sunny, amazing that you are actually able to pull off these youth programs at a time like COVID, and to have the kind of participation you're having is amazing. It speaks volumes of starting with Julie and working all the way down to you as to how an organization run properly and effectively can make such a major impact in a community. And so kudos to you guys for all the work you're doing and for being able to provide something so crucial right now in a time where I think our most vulnerable are the kids that are missing that emotional connection to so many. So on that, thank you very much. I did notice that you're asking us for about 16% of your working budget for Nantucket. Is that correct? About 16% of the budget, overall budget for here? Which really is ironic because your services have increased over 23%.
Oh, can we amend our request? It's late.
I would advise that you relook as we've always had. I know that respectfully, I know that you and with your vast history, Julie, understand how state and local governments work. And I understand why you asked for us for grants in the proportion that you do. But as we say to everybody, all we can say is no or give you less than you request. We can never give any organization, no matter how good their work is, more than they request of us.
Okay.
Okay. But I did notice, I was going to ask you about the cut in your budgets from fiscal year 2021 to 2022, but I think you touched upon that. I thought it had to do with a part-time nurse practitioner, but you're saying that had to do with the housing survey, for the potential of moving locations. So that's why we have that cut in actual total expenses from 2021 to 2022.
Yes.
Am I correct? Okay. I just wanted to make sure that I understood that properly, because that was one of my questions. Okay. I don't think I have any questions, but we do have another organization waiting to get on.
Okay.
I do want to know, we are still doing the interviews. We understand and respect if you do not want to do those on site, but Sunny, if you could let us know how you would like us to do our on-site interview, or our more in-depth interview, that would be really awesome.
Sure. And
I do think I did have one other question. I noticed that you, okay, Linda has come off the site, everybody. She just wrote to me that she's a town engineer on a site. She has left our meeting.
Oh.
Okay. I noticed that you have been speaking a great deal about your collaboration with Fair Winds. And it seems a stronger collaboration than we have seen in the past. Is this true?
I would say yes and no. I have tried really hard to make as many partnerships as make sense work. Mm-hmm. I think Fairwinds, with their change in executive director and change in the way that they're delivering services, it's just harder to pull those pieces together for those reasons. But I think that they offer obviously a very valuable and complementary skill set. So I do try to partner with them as much as it makes sense.
Okay. And hats off to 29 collaborations. I think that's the highest collaboration I have seen in any human service contract we've had in front of us. So
that's awesome.
Congratulations, guys. If nobody has any comment to make, I don't know if Rachel or Jericho have anything they want to add. I'm going to respectfully say that, Sunny, if you could reach out to Ann and let us know what works for you, and then we'll come up with the dates that we have available to meet the needs of our interview with you. Okay.
Great. Thank you all for your time. I appreciate it.
Thanks,
Thank
everybody.
you.
Great report.
Thank you.
Here's to 2021.
Yeah.
Yeah.
Everyone.
Bye,
Okay.
everyone. Thank you.
You're welcome. Thank you, guys. Okay, we have the Artists Association on. We have Courtney Bridges and Elizabeth O'Brien on with us right now. I just want to clean up my paperwork. Hi, Courtney. How are you?
Hi. Sorry, we just, tuned in a little early. We always
No,
wanna
no,
make
that's
sure-
fine. It's a public meeting. You're welcome to tune in at any time.
Great.
It's also interesting to watch other people, isn't it?
It is. Well, thanks everybody for your time. You guys are just going one after another. Have a sip of coffee, get your next little paper stack ready, and you let Liz and I know when
We're
you'd
actually
like to begin.
We're actually ready, Courtney. What we'll do is have you introduce yourself, and you, Elizabeth, if you'd introduce yourself when done with that. And then we have some new board members, so I'd like them to introduce themselves, and then you can make your presentation to us.
Great, wonderful. Morning, Courtney Bridges. I'm Executive Director at Artists Association here on Nantucket, and this is Liz.
Muted. Okay. Hi, I'm Liz Hunt O'Brien, and I am the Public Programs Director at the Artists Association.
Okay, fabulous. Bert.
Bert Johnson, the representative from the Nantucket Planning and Economic Development Commission.
John DeLosh, a member at large.
Nope.
I'm Jill Veith, and I'm on the Finance Committee. Dorothy, I got to recuse during this because I'm on the board of it.
Okay.
Good.
Brooke?
Do we
Brooke
have a
Moore?
quorum if we do
I
that?
don't know. I'm going to check. I
Right.
think we do. Excuse me. 1 second. And we have a quorum, correct? We have 4 of us.
Yes.
Okay. We do. Thank you, Jill. Brooke?
Brooke Moore. I serve in my role as Chair of Council for Human Services.
And it's me, Dorothy. Hi, guys. Courtney and Liz, if you, and I'm sorry. We also have Rachel.
I'm Rachel. I think you know me. I do have to hop off quickly for a budget meeting, and I'm hoping it'll be quick, so I should be back on. But Assistant Town Manager Rachel Day, and I am assisting our new Human Services Director, which is he still on here?
He's still here. Yep.
Oh, okay. This
He's here.
screen's just small. Sorry,
Okay.
Jericho.
And then Jericho.
So I'm Jericho. I'm the aforementioned new Director of Human Services.
Fabulous.
Welcome.
Okay, so Courtney and Liz, if you two can make your presentation to us, that would be great.
Great. Well, I trust you guys all received the application and looked at it thoroughly. So I'm just going to give you some highlights and some new survey results that I'm excited to share with you.
Okay, can I ask one question before you start? And I'm sorry, just to clarify this. On the front page of our document, it says amount requested 22,100. On the second page, it says 21,000. Am I correct that your first page is right at 22,100 and not your second page at 21?
Yes, thanks.
Okay, great. Okay, thank you.
Thank you.
Yes, correct.
So the Healing Through the Creative Arts program is something we've been offering at Artists Association for 5 years now. But this previous year has been our most successful ever. And it was also the first year that we received funding through you guys. So I wanted to say thank you and celebrate that for a minute. I'll tell you some of the success we had through this program. So the real idea here is that participating in arts and cultural activities is something that can support the underlying mental health of the community. And we see that in a normal year, but particularly in this past year, we saw results in healing through the creative arts. I was looking over our survey. So we had surveyed our class takers who joined us for this fall session of classes. And that was the first time that we offered the scholarship for the healing through the creative arts, especially to our frontline hospital workers and teachers. We had 31 healthcare workers take advantage of the healing through the creative arts and 12 teachers. And from that, half of them denoted that they signed up for the class in particular to reduce their own anxiety. And I think that this is what we're really trying to do here, is take some of the pressure off of high level clinical services that maybe through these supportive experiences, folks have more tools in their toolkit and hopefully can take the pressure off of our clinical services that we offer on the island. Also, we were able to respond to 13 of those students who told us that they were interested in learning more about mental health care. So in that aspect, this was a new victory for us because we were able to take those folks who gain benefit from the healing through the creative arts and help them get more help because they felt that they needed it or wanted to speak to learn more about other services available on the island. So that was a real collaborative opportunity for us as well. And those are just really the first quarter results of the program. And we expect to see this continue. And because there was so much interest in this first quarter, we increased our ask this year. Last year, I believe you guys supported 51 students. We request this year that you support 65 students.
Okay. Liz, do you have anything to add to that?
Thank you, Courtney. Thank you, Dorothy. I thought that was a great summary of everything. I just wanted to say on a more sort of human note that we got such a great response from, just talking to our adult education programmer and our children's, that I think we use this mostly for adults, I'm pretty sure, but that they could not believe the response and how much it helped people. And it was just a great thing to see. And I think it really, was sort of surprising, but not really. And we were just really thrilled that so many people took advantage of it.
Okay. So you have anything else to present to us?
No, we're happy to answer your questions if you have them.
Okay. Bert.
How many participants did you have in the program this year?
So far this year, we've had 43 participants.
Mostly high school age or adults?
Adults.
Thank you.
Okay, Brooke.
I always ask the same question of every applicant. How do you support folks for whom their language is not primarily English? Do you have any programming or outreach or in this area?
Brooke, we can definitely do more there. As far as our youth classes go, we have a Spanish-speaking youth instructor, and she works with us anytime, but in particular when we do outreach programs like at the Boys and Girls Club or with our public school students. Our adult art teachers are not bilingual. When we have the opportunity to welcome someone into class, we always do. And we have had folks who take our classes whose language is not primarily English. It's not always an instructive experience, especially with the healing through the creative arts. It's truly a process experience. So they're able to get the benefits. Anyone can get the benefits.
Okay, thanks. That's all I had.
John?
I don't think I have any questions.
Okay, I have a few, Courtney.
Great.
Of course. Why do you feel that you don't have students involved in any of this program? Number one. Number two would be, are you successfully able to run all these programs with COVID right now? Do you feel that you've learned in any way ways that you can change the program to encourage even more participants? Those are just a few of my questions.
Great. I'm writing them down so that I can answer each of them.
Okay.
Okay. First, our youth program is very strong, and we have youth scholarship already. And that allows us to welcome, for example, the golf club. They fund a Boys and Girls Club scholarship that allows us to welcome those youth to the program. And so we do serve many youth and are able to provide the Healing Through the Creative Arts programming for the youth already. The adult programming wasn't as well funded, but was in higher demand this year. And so by that necessity, most of this funding went toward adults.
Okay.
For COVID, we are really proud of how we've been able to operate. We worked closely with the health department, with the hospital, with other advisors to make our class sizes smaller. Everyone operates at social distance. Folks have their own individual materials, masks, wayfinding. We're really proud of the work that we've been able to do. The changes were hard, as far as running a business goes. We used to be able to fill a class with 10 folks, and now we're filling a class with 5 or sometimes 4, just to be safe. And we're going to continue to do that because it's most important that everybody stays safe. That being said, we did run a full suite of programs in the summer. And as you heard earlier, Healing Through the Creative Arts was pretty much our main feature of the fall programming. And what we have learned, we've learned a lot. What really this year was the first year that we integrated the healing aspects into all of our classes. And that was the real opportunity because folks were coming to class, everybody was maybe feeling a little stressed. And so they were coming to class and getting the benefits of a healing arts program without having to sign up for a class that was called Healing Through the Creative Arts. That was really our big learning here. Folks could get the extra support, and we were providing this loop so that they could get more services if they needed them. But now our reach was much broader because everyone was getting little aspects of the healing program, no matter what class they were taking.
And of the 13 students that you said that you were able to can help, in what way were you able to help those 13 students? What access did you give them to other programs?
So the 13 folks, they had replied to us on the survey that they wanted to learn more about mental health care opportunities for them. And some of those folks worked in a place where they could have access to healthcare, mental health care through their work. So we gave them that information, and the rest we suggested that they get in touch with Fairwinds, and through that we have just information that we passed on to them. So we don't make appointments for people. We just give them the information.
Okay, and so do you also include in there all the private sector that's available?
We didn't, but we can.
Yeah, I think it would be wise that people have choices, and maybe if you have that capability, if you're going to suggest Fairwinds, I would suggest all private sector therapeutic abilities too. I think that allows people a broader perspective and availability to services that are around.
Great. We will do that. I think the more choices people have, the better.
Okay. And I did have, this is a silly question. Who did your, Liz, did you do this application?
Yes, I mean, it's always a group effort. And, for instance, our finance department put together the budget. But most of the narrative I did with the help of Courtney and her copy editing skills.
I will say that I showed your grant to the whole board because I was impressed by the black and green writing. Courtney's very smart, very, very smart. I got the message. Well done, very well done.
Thank you. Thank you.
It's so much easier to read that way.
Oh, yes, and the message is there. We got the message. So I thought it was very well done. Some of my boards did not get it in the green like I did, but it was the very first thing I noticed on your application. So great work on the artistic editing of your grant. It comes through at all levels. I'm glad to hear that this program was a success so far. That it was something we debated a great deal on the contract review committee about the importance of this program as last year. And the viability, and you're proving to us that our support of the program had benefits and we were correct in the way we went. So that is always good for us to hear. It's also nice to see programs that help our front line now, especially right now, because I think the stress on them, we have a lot of programs available for our youth, maybe not enough, but we do have them. And this seems to be, we expect adults to be able to make it through on these things. And sometimes, when we're carrying the burden of everybody around us, we need help equally. So great job, guys. Great job.
Thank you.
Yeah, no, I'm interested. It'll be wonderful to hear your end result as we go on this year as to how this really has impacted, especially it came in probably the most important time in Nantucket history. So thanks, guys. You were ahead of the curve.
Well,
not necessarily where we wanted you to be ahead of the curve for, but you were ahead of the curve. So thank you. Does anybody else have anything to say? I know that Jill is like dying to say something and she can't, so I'm very sorry that she can't. We respect her having to recluse herself, but we can see by looking at her that she too is very proud of what you guys have done. I think I'm speaking just from what I see, but I think that that's pretty obvious. So Courtney and Liz, thank you again very much. We really appreciate it and continue the hard work. It's great.
Thank you. And we really welcome any feedback. I mean, I know this is more of a formal interview really about the application, but we see this as a partnership. And so even hearing that the frontline worker effort was impactful to you guys, that sort of feedback helps us. Hearing from Brooke that it's important that we reach all of our communities, and just any kind of feedback like that is great. And we will certainly add the private sector therapies to part of our outreach.
Okay, thanks. And the other thing, the interview process, you know how we do the on-site interview. And of course, last year, I think that on-site interview actually brought you over the hump. And I believe it's a vital part of what we do. So we understand and respect what's going on with COVID. We still would like to do that interview process, but on your terms. So if you can reach out to Anne and let her know what you're comfortable with, and then we'll set up the interview, that would be great. Okay.
Great. Thank you.
Okay. Thank you.
Thank you.
You're welcome. Stay healthy, guys.
Thanks, guys.
Merry Christmas.
Merry Christmas.
Bye-bye.
Bye. Okay, I think our next sector is going to be a safe place.
Dorothy, I need to duck out for a sec. I'll be right back.
Okay. I'm just checking to see. I didn't print the exact times.
11:25.
11:25. So we have, do we want to see if they're available early, Anne? Or if anybody wants to have a discussion right now from what they've seen or heard, or Jericho has any questions because he's also new to this.
I'm mostly just kind of sucking in the data in terms of who's doing what at this point. Nothing particularly specific at the moment.
Okay.
Dorothy, because I came in late,
Mhm.
did you discuss your interactions with Gosnold before I had joined the meeting, or is that something?
Oh, okay. So, you know,
Right.
I reached out to Gosnold after we received that email. And primarily I reached out because it sort of put a red flag up to me with all the efforts that we have done as a committee to try to endorse Gosnold. It was saying to me, uh-oh, are they closing their doors here? That's what was my first feeling when I got that. I reached out to Tammy to talk to her about it. She didn't seem to know who Nancy Rappaport was at first, which really concerned me. And Nancy Rappaport, of course, is their local director. I asked whether they were looking at cutting services. She said, well, you know, we've always gotten town grants, so we pulled the grant for this year. We don't want to do it. Well, they've never asked us, as you and I know, for any grants. So I really asked her to please give me a more honest and detailed answer as to what Gosnold was really up to. She promised me that she would do that by Friday. And I really did say to her, and I was quite honest, I said, I have been one of your biggest advocates. And because we've needed such diversity in this field of substance abuse and understanding of the disease of substance abuse. And I wanted to know where the town stood with this. So I think that's what I'm waiting for. So I officially haven't really pulled their grant until I get an official notification of what Gosnold is really up to. I think that's important for all of us. As you know, John, we've advocated and people have said to us, well, what is, you know, and we've sort of pushed that, hey, and I think in our pushing, we sort of made other organizations step up to the bat a little differently and have to be more aware of what their services were and made them more accountable to us with their services.
I think you initiated that with the on-site interviews, particularly. I mean, that kind of, I think that brought it home to many of the ones that actually the ones that you and I have gone to, people who are on it anyway, but I do think that has helped everybody step up their game.
Yeah. So I think, so that's what we're waiting for. And guys, why John is saying that is because I made John come with me to Health Imperatives because he thought it was only about birth control. And he became so, if I believe, you know, to say this, he was amazed at what they provided. And, you know, I think it proves that we all, if you go into something with an open mind, can really get a better understanding of the importance of the different programs out in our community. So that's part of the interview. And also the other part of the interview process was to sort of put them on their own turf where they can talk more and feel more at ease with us. And I think over the years, it's actually opened up a much better communication between us and the organizations. We tend to get a much more transparent discussion. If you ask the questions, you honestly get their honest answer about where they might have failed and where they are, they think succeeding. So.
Yeah, that was a very good presentation. Unfortunately, I got to run for a few minutes. I should be back in about, hopefully I'll be back before the next group goes. I'll be right back.
Okay.
I was going to ask you a question about them because it wasn't in the grant, so I assumed it wasn't part of it. But do they also provide abortion services or counseling or referrals or something like that? I mean,
Health Imperatives?
Yeah.
Health Imperatives does not perform abortions.
I didn't know if they like counseled. I mean, you know, some of the words are, when I say reproductive services, I wasn't sure everything, but they.
I don't think, you know, as far as we know, that's never been part of the conversation. I'm not sure that they have the proper You would have to see where they perform these services out of. You would be amazed at the amount of people they see and where the services are actually given. It is
Oh, and it said 750 families. I was like, wow. And
If
60%
you could-
of them don't have health insurance.
Have you ever been up to Gwynn Village?
I haven't. So
Okay, so Jill, I think that you might be somebody that if we do an on-site, you should see what they provide. Oh, look at the family photo there. In such an amazingly small clinical area.
Yeah. No, I'd love to, or a virtual tour if that's how they have to do it.
I think you should. It's amazing.
Okay, thank you.
We have somebody's, we have Carrie Bridges, and then we have somebody's family photo up.
Oh, that's, wait a minute.
Hi, Linda.
I don't know why. Oh, here we go. Is that better?
Wonderful.
It's a nice family.
It's a wonderful family.
I haven't seen them for over a year, but I'm sure they're all fine.
Oh, good, good. Okay, we do. What we were gonna do is our Human Service Director, Jericho Mealy, had to step away for a few minutes. He's hoping to be back on. We're gonna do the introductions and then we'll start. And when Jericho comes on, I will have him introduce himself, okay?
Sounds good.
Okay, Carrie, if you wanna start with and here comes Jennifer. If you guys want to start with introductions and then I will have our board introduce themselves, okay?
Sure. My name is Carrie Bridges and I am the Director of Communications and Community Outreach here at A Safe Place. I work with Jennifer hand in hand.
Okay.
And I am Linda Hoey. I'm the President of the Board of Directors of A Safe Place.
Okay. Oh, there she is.
There she
I'm
is.
here, yes. Hi, everyone. I'm Jennifer Frazee, Executive Director of A Safe Place.
Okay, and I'm gonna have everybody introduce themselves so that because we have some new faces. Bert?
Bert Johnson, the representative from the Nantucket Planning and Economic Development Commission.
John Belange, member at large, sorry.
That's okay. Brooke?
Hi, I'm Brooke Moore, and I'm here in my role as Chair Council for Human Services.
Jill?
I'm Jill Veith, and I'm the representative from the town's finance committee.
Jericho.
Hello, I'm Jericho. I'm the new Director of Human Services.
Okay, and you all know, well, I don't think Carrie knows me, but I'm Dorothy Hertz, Chair of the committee. Nice to meet you. As what we normally do, since this is your first one with us, Carrie, we have everybody, you will present, your group will present to us, and then we will ask any questions we have on your grant. Okay? So the floor is yours, guys.
Right. Well, good morning, everyone. Thank you for having us here. Thank you for reviewing this proposal. So I'd like to start by just talking a little bit about A Safe Place services. Many of you, if not all of you, may know a little bit about A Safe Place, but just a general overview. A Safe Place is the local domestic violence and rape crisis center serving Nantucket. Within A Safe Place, we have 5 different programs. So we have a domestic violence program, we have a rape crisis program, we have a supervised visitation program, we have a trauma therapy program, and then a child witness to violence program. So the first 3 of those programs are more supportive in nature, and then the latter 2, the trauma therapy and the child witness to violence, are our therapeutic programs. So they are staffed by licensed clinicians. I think it's important to note that all of A Safe Place's services are completely free of charge. So we don't accept any insurance nor any money from anyone who walks in our door or calls us or needs help. And I would say that all of our services kind of fall into one of 2 categories. Either one, the direct services that we're providing. So those direct services to survivors in the aftermath of domestic violence and sexual assault and or their family members who've been impacted, as well as our outreach and prevention services. So in fiscal year 20, A Safe Place served 307 individuals. That number was up a little bit from the previous year, fiscal year 19, when we served 286. But I think what's kind of more important and more relevant at this time are the numbers that we've seen since the pandemic hit. So just before this meeting, I was kind of preparing those numbers and breaking it down by programs. And what we've seen in both our domestic violence and our rape crisis programs are a 30% increase in the numbers of people that are reaching out and receiving services. So in those two programs, we've seen a major increase in the numbers served. I'm very happy to report that despite the pandemic, despite the shutdown, A Safe Place never had to stop services. We just kept it our mission and our goal to be able to offer those services 24 hours a day like we normally do. Some of the services looked a little bit different. There was a period of time during the shutdown when our inner office was closed to survivors, to clients. But during that time period, we provided all of those services remotely to the ongoing people that we were providing services to. So the supportive counseling, the therapy, the case management, the advocacy, that remained in a remote way, whether it was via Zoom, GoToMeetings, or over the phone. I will point out, though, that even during the shutdown, when our office was not open for a period of time, that we remained available in person for emergency purposes. So we continued to man our 24-hour hotline, and through our 24-hour hotline, we did respond to the police department and to the emergency room in the aftermath of domestic violence and sexual assault. So even during that shutdown period and moving forward into the pandemic, we were still providing those kinds of in-person services. We also, during the shutdown, we saw a huge increase in basic needs requests. So people needing food cards, hygiene supplies, diapers, those kinds of things. And so advocates were still available to help with those urgent requests, and oftentimes would go deliver those to people's homes. During that time, we actually collaborated with the restaurant downtown, The Beat, and we provided meals, dinners 2 times a week with The Beat for 8 weeks. So we provided over 1,000 meals, and advocates distributed over 500 of those. There were a lot of clients of ours that were unable, due to like transportation purposes and whatnot, to make it to the office to pick those up. So our advocates went out and delivered those meals. So that was a huge undertaking, but I think very valuable to the people we were serving. There were also some other emergency situations during the shutdown that our advocates were assisting in person. Just as a couple of examples, there was one case where we learned of a woman who had fled a situation of domestic violence, and she was living in her car. So 2 of our advocates personally went out and jump-started her car when her battery had died. The advocates filled her gas tank when the gas ran out, and then they were able to help her and her car get off island to a safe location. In another example, we helped a woman that was also fleeing a situation of domestic violence. We helped her and her children get off island to a domestic violence shelter. So even though some of our services went remote, we still were providing in-person services. And then the end of June, we did fully reopen our office up for all services again. But we continue to provide remote services. So we are working kind of on a case-by-case basis, whatever is most effective and safest for the person that we're helping, as well as the staff member. So we continue to provide all of those services, those direct services. In terms of our outreach and prevention services, the first 3 quarters of fiscal year 20 looked very similar to previous years. I know that there's probably at least a few of you that are familiar with some of our outreach and prevention services. We try to do a lot of prevention, in-person prevention with youth. So we did provide those kinds of prevention services at the Nantucket Boys and Girls Club, the new school, the middle school, the high school. We were being invited in probably more often than in previous years. So things were going really, really well. We were, like in previous years, we were running our high school prevention group, the SAFE group, which stands for Student Action for Empowerment Education. New this past year, we also were one of 3 sponsors that created the Nantucket PFLAG group, that supports the LGBTQ community, as well as their friends and family and allies. And so in terms of outreach and prevention, things were going really, really well. A lot of success stories in there. Then, of course, the pandemic hit. All of that kind of came to a halt for a couple of months. And then we slowly and surely have been diving back in. It's a little frustrating in that, we love doing in-person prevention, and that really isn't possible right now. So we're trying to be creative and do our outreach and prevention in other ways, really focusing on our monthly newsletter, e-newsletter, distribution of brochures, promotional items, lots of different advertisements. We had an ad that was running through the Dreamlands at the drive-in. And then participating in any and all kinds of community collaborative meetings and such, just verbally making sure that people, especially professionals, know that we're available, so then they can also make referrals to us and support the community that way. And then we've been doing a lot of awareness raising activities. And in just a minute, if interested, Carrie can maybe talk about some of the awareness raising activities that we've done during Domestic Violence Awareness Month, and a more recent Take the Mask Off domestic violence project that we were doing. But I just wanted to end by just going over the proposal that's before you. So what we are looking for, we're asking for $55,000, and $8,000 of that would be applied to our 24-hour hotline, $2,000 per quarter to be able to help us man and answer the hotline, and then respond to the police department and to the hospital in the aftermath of domestic violence and sexual assault. And then the other 47,000 would be equally divided between our court advocacy program, where we provide a court advocate for every district court session, which we've been doing throughout the pandemic as well. Sometimes court was held via Zoom, and then more recently it returned to in-person. And then also it would be, the money would go to our supportive counseling and case management, as well as continued community outreach and prevention program. So I will open it up for questions, and or if Carrie wants to elaborate on any of the awareness raising activities.
Yeah, Carrie, can we hear from you?
Sure. Sorry, I thought I was on mute there for a second. So as Jennifer said, October was Domestic Violence Awareness Month, and we did several activities during that month, including, as most of you I'm sure already know, the Walk a Mile. Our Walk a Mile is usually done in the summertime, and this year we decided to do it in October. And unfortunately, it was virtual, but it was actually quite successful, because we were able to do outreach not only and have people walk, not only people here on the on the island, but throughout the United States, and even internationally, which was great. So that outreach program was quite successful. The Take Off the Mask program is actually still ongoing. It was started in October, and we collaborated with several agencies, including the Artists Association, the Athenaeum, the Boys Club, and then we did another paint night at the Rose and Crown. So what we did was, the theory behind this is you want to paint a mask and be able to take it off to show what domestic violence looks like. And currently, if you see our tree on the top of Main Street is decorated with those masks that were decorated by all 3 of those different agencies. And the Rose and Crown allowed us to come in with Tara Corbett and have a paint night with those masks as well. as far as our outreach with the schools and our educations with the schools, everything has been put on hold until we can get back in there. A couple of the things that we were initially going to be doing this year was starting a self-defense course, and actually the high school and the junior high school had actually reached out. They're trying to get us on their year-round curriculum to be able to come in and teach self-defense. Myself and Carla Zinnes, who is one of our Spanish-speaking advocates, taught it quite frequently for the last 2 years at the Boys Club. The health teachers allowed us they offered the students a credit if they participated. And then we were able to offer it out to the public for free as well, for both men and women. It was something that we were hoping to continue, and we have partnered with Lisa at Cyclin Fitness. She allows us to use her facilities for free. So all of these things taken into context, we had to become very creative as far as doing outreach this year. We did partner with the food bank this summer. I volunteered a couple days a week to deliver food, and we were able to put our flyers in each bag that we delivered. She was delivering to almost 200 families per week, so that was a great opportunity to be able to touch base with those families and contact them, let them know what our services are and were, and that we were still available for them to see. We've partnered with the Boys Club for an ACT Teens group that we have been working with for actually 2 years. And now since everything has been shut down, we've been reaching out to different agencies to try to get things for teens to be able to do, especially in the winter months. So if anybody knows the gym over off of Orange Street, Isaiah Gym, he is actually going to be offering his gym facilities and his personal trainers to the ACT Teens group. So those are just a few of the things that we have been doing just to be able to be a little bit more creative as far as our outreach.
Okay. So maybe can I put a word in for the board and how we're doing with our fundraising and raising money?
We would love to hear from you.
Naturally, in this crazy year, we have had to pretty much cancel all of our fundraising efforts. We had a luncheon scheduled this year with Elizabeth Smart, and that has been postponed to 2022, although we haven't yet been able to determine if we can have it or not. It was a great event. It was a 2-day event last time with Ali Raisman, and this time would be the same format. A free program to the public, anyone on Nantucket at the high school who wanted to come and hear the story, and then the following day a luncheon at the White Elephant. And it was very successful to bring our story to the forefront of the people who come in the summer and didn't even know we existed. So we got the word out really well for that, and we're actually starting to reap the benefits. So that's the good news, even though it was canceled. We also produced our first annual report this year, which was very well received, and we sent it to our entire list, and that was a big first for a safe place. We feel like we're really coming into ourselves now. And our Walk a Mile, although we didn't do as well as we have done in years past, we did really well, I think, for the way we were trying to do it virtually, and so we were pleased with that. So our fundraising and our annual appeal is going on right now. We didn't lower our expectations this year. We've written personal notes on every single letter that's gone out, the board members have, and we've had a really good response. We're pretty much running even to where we were last year at this time, which is pretty incredible, I think. So although our hands have been tied on our fundraising, we've been still doing almost as well as we've done in the past, but we're on it. We're working hard, and it seems to be paying off. So the board is busy.
Awesome.
Yeah, and I just wanted to highlight one other really exciting thing. I think we were able to this past year hire our first ever Portuguese speaking advocate. So we're very excited about that. We recognize that through a strategic plan that was approved this past year, that the Brazilian community is one of the underserved communities that we reach. And so we really made it our goal, and we were able to hire a Portuguese speaking advocate. And so we're very excited about that. And we still have two Spanish speaking, two Spanish speaking advocates and one Spanish speaking therapist. So we're very excited about that.
Okay. Bert, questions?
No questions.
Comments?
No, I mean, they've been around for a long time.
That we have.
Okay, John.
I don't think I have any questions, but I am impressed that you've been able to, through this pandemic situation, continue to apparently effectively serve your community. And I have to believe that the stresses have been considerably increased.
Well, I personally can't say enough for the staff who've just been working 24/7 and doing such an amazing job. I'm so proud of them. They're doing a great job.
Thank you.
Brooke.
You answered the question. Yeah, you answered the question I ask everybody about bilingual services. And so
nice.
with gratitude, that is a passion of mine. And do you have printed materials in multiple languages as well, outreach materials?
Yeah, we've been very lucky. We've had all of our material has been in Spanish for many, many years. And then since hiring our Portuguese speaking advocate, she is actively working on that. So slowly and surely, we're getting all of our materials in Portuguese.
That's great. And I just want to affirm that for the first time, I know someone who's taken advantage of your services this year. And when it gets close to one's life, domestic violence in particular, like knowing that you're there for people that I care about is really important. I just want to say thank you.
Oh, thank you.
Thanks, Brooke.
Jill.
Yes, thank you. This is, I'm learning about your organization. I've heard about it for years, and it's always had an excellent reputation. I kind of want to focus in on one of your really smaller aspects, I think, which is PFLAG. Is that a newer program that you started? I know they gave a presentation at my daughter's school. And is this just part of your awareness program? How much of the grant goes towards that? And I'll just be very direct. I'm a very transparent person, or I try to be, Jennifer. That particular group in my past life, I believe they're fairly political group. They're very political. They're an advocacy group. That's what they're trying to do. But I think that they give donations to candidates as well. I don't know if it's in the umbrella that you're operating with, but I'm pretty sure that they do give money to candidates for office. So that's just something that, for lack of a better word right now, that flags for me. And so I wanted to ask you about that. Maybe I've got that wrong, please correct me if so.
Yeah. So what happened, I brought up the strategic plan, and through the strategic plan, the LGBTQ community was one of the other areas, the underserved populations that we recognized that we could do a better job with. And so kind of around that same time, and Carrie, you might be able to help me out with this, a couple of our staff members had a meeting with the Boston PFLAG group. And that's when the Boston PFLAG group came down and went around. And I know that they met with some students at various schools, and there was
Okay, so that was not through you.
that was no, it was our staff members helped kind of facilitate, bring that down. But then really what is being created is a support group. So what the Nantucket PFLAG group is, a support group, and they were meeting monthly in person, but then it went to a virtual remotely because of the pandemic. And so our involvement really is that 2 of our staff members have gone through training to be able to lead these support groups for the LGBT community. And really it's much of it is focused on like friends and family and allies of that community, but we don't provide any funding per se, besides the fact that our staff are part of this group and attend and lead these support groups. And Carrie, I don't know if you have any additions to that or anything.
Just that we have partnered with ASAP, Alliance Against Substance Abuse, for this project, and I believe NAMI is in that collaboration as well. So it's not just us; it's also two other agencies that felt that community aspect was underserved and needed some attention.
I don't think you answered Jill's question, though. Am I correct, Jill? The question didn't really get answered, or did it?
Well, I'm not suggesting that Safe Place is politically involved. For me, I thought that PFLAG is, and so as an institution, when they give political donations, are you aware of that? Again, I might be wrong. That's just from my memory in a previous life. And that's a little bit different, I think, for the town to consider giving money for an organization. You see where I'm going, probably.
Yeah,
but,
yeah. Now
advocating for certain people to be elected or not. And I think that's what we're trying not to do here. So I just wanted to make sure, and please, if I'm totally wrong, just tell me.
I've never known the larger PFLAG group to do that. But I don't know 100%. I'm fairly confident they don't do that, but I can assure you that our local Nantucket PFLAG definitely does not do that.
I guess the question is, Jill, if I might ask this question of them, Jen, I think she's asking whether if any funding that we give to FLAG or to you goes directly to FLAG, and who then supports maybe political contributions that we're not allowed to support. Is that what you're asking, Jill?
Yeah, I just wanted to make sure that the money that's going towards your having groups or outreach, is that going back to this organization that, again, I know them to be very political. So even if you could just find out the answer for me, Jennifer, about who they give money to.
Sure, yeah. And I could assure to you as well that we at A Safe Place would not use it for this group. If we do determine that the larger PFLAG does in fact do any of that, I would assure to you that we would not use the funding for that purpose or for that group. But I'll definitely look into it though, because I'm curious. I've never heard that. So I'm personally interested in that as well.
Great. I mean, I think I can just say, obviously the money that the town wants to give is to go for your services and not I wouldn't see the appearance of impropriety there.
Yeah.
Thank you.
Agreed. Thank you.
Okay. Jill, is that it for you?
I think I'm good.
Okay. Brooke, I saw that you had your hand up.
Yeah, I just did a quick Google search, and PFLAG is a 501c3. And they're stated, they actually have a web page on their 501c3 rules that states that they can't support they can do legislative lobbying, but not political or
not direct
electoral activities.
But I thought they did have an organization that they're affiliated with, like a separate one for donations.
Okay. So they do, I'm just I just did a quick search for my own curiosity, and
Yeah, I just
so-
brought it up too, to be honest with you. I brought it up to see, read about it. But I think that all in all, that Jennifer's answered the question, which is that their intention is not to fund any overhead, any overhead that would be contributing to any political venue. I think it's a program that they've brought in to help with students become more aware or able to talk, and families in the this much needed community on the island. Am I correct, Jennifer, or am I?
Yes,
Okay.
absolutely. Yes.
Okay. I have some questions for you. Of course. How many children do you have in your in the 2 youth programs, the children from domestic violence and your therapeutic counseling program?
The domestic violence program, those would be adults served. So the child witness to violence, I'm going to give you a rough number, but I can get back to you with the actual number.
Okay.
So trying to see if I have I just gathered these numbers, but I didn't bring them with me right now. In the last year, I believe we've served about 45 children. And like I said, though, I will make sure I get you the actual number, but I know it's right around that number.
And this is the Witness to Violence program?
That's the Child Witness to Violence program, yes.
And this provides free, I'm just doing this so some of the new members understand, this provides free therapeutic treatment to 45 children?
Correct, yes.
And do you know how often they get seen?
It kind of just depends on the child's, what their need is, what the family need is. There are some children who, let's say they've been in the program a longer time, and let's say they're like teenagers and they've been in the program for a couple of years or whatnot. They might be seen less often. It might be like a monthly check-in. Many of them are more like weekly or bi-weekly, but again, it kind of depends on the individual situation.
Okay. Jericho has to leave, so that's why I was waving goodbye to him.
Yes. Thank you very much for that presentation. I know and have been, I know people who have participated in Safe Place. It's probably the most trusted kind of help thing on the island. And this was a very good presentation. I'm sorry I have to run away on other business, but very nice job, everyone. Thank you.
Thank you, Jericho.
Okay,
and I'm sorry to disappear on you guys, but I have something else I have to take care of.
No, that's fine. Bye. We're talking a lot about you having translators there. How about, it seems to be the one group that we never talk about is the Eastern European.
Mm-hmm.
And can you talk to us about what you have available for I mean, I know that a lot of them, English is their primary language taught in school besides their basic language, but having worked with an awful lot of Eastern Europeans, I understand that it is still a major issue here on the island, is their ability to be translated?
Yeah, I would agree. We were lucky in that we actually had someone that worked at a Safe Place years ago from Bulgaria, and she actually spoke multiple languages. And then actually more recently, we had someone as well. So years ago, they did actually translate much of our material into, I believe we have Russian and Bulgarian. But what we have found, we certainly do serve that population, but like you said, we have found 99% of the time that they will come in speaking English and actually request services in English. So that has been, it hasn't really been an issue. But I will say that we have an account with the language line. We also do have, we're part of a state coalition, and we maintain a list of all of the other domestic violence and rape crisis programs in the state. So if someone walked in our doors and spoke a language that we didn't have someone on staff that spoke that language, we would either try to utilize the help of someone at a domestic violence or rape crisis program that did speak that language, who could help us over the phone, or use the language line to be able to provide those services. We haven't found a need to do either of those in many cases, but we certainly do have that option, and have used it throughout the years.
Okay. And one of the biggest, last year when you came in to see us, your pitch, as I might say, was for a better prevention education program. That's where you were really seeing that you really wanted to focus. Do you believe that you are seeing what you wanted to see? I mean, taking into consideration COVID, which we all have to. Do you feel that the foundation of the programs that you're beginning to be able to present are going to be sustainable and accepted? And on that note, how many of those organizations are you actually collaborating with that are actually maybe running programs that are similar to what you're doing? Are you working more with more organizations to try to pull together on that?
Pre-pandemic, we were having so many successes. I think we were providing more prevention programming, especially for youth. And the feedback we were receiving from the Nantucket Boys and Girls Club, the new school, the middle school, the high school, they were wanting more of us because I think they were seeing it as successful. And so they were asking us to come in more and more. It's really hard to answer that since the pandemic because everything is just turned upside down and those in-person prevention programs are not happening. With that said, Carrie's doing an amazing job communicating with all of those organizations, schools, teachers, whoever it is, and they're all saying they want us back. So I think we've established those positive relationships and they've seen the successes. So I think we'll be able to get back, especially at the Boys and Girls Club and the schools that I already mentioned. Does that fully answer?
Yeah, it answers some of it. I noticed we had Health Imperatives spoke to us first thing this morning, and they talked to us about their Zoom programs that they've been able to put together, their youth programs, which seem to be working quite well. And whether or not some of your programs they seem to have maybe the same foundations, and whether or not you would look at doing some collaboration with them on a couple of their programs. I would believe that between the Safe Place and Health Imperatives, it could be a much stronger entity into the town and into the town.
We do collaborate with Health Imperatives for our SAFE group, the high school prevention group. So that's been a long-standing collaborative effort there. I don't know what they're referring to in terms of their Zoom successes with youth. I'm wondering if those are more like one-time presentations.
Well, they have a bi-weekly group that's getting together.
Okay. Is that a support group or is that
actually
a prevention group?
It is both. It is, they're doing one that actually talks about, they do a physical activity, and then after the physical activity, they talk about the emotional needs of a person and then the health needs of the individual.
Yeah.
Sorry, I have to go through all.
Oh, that's okay.
I've written,
That's okay. Yeah. I mean, I would love to get involved in something like that. I'm actually surprised because one of our advocates for Jay, she's the co-sponsor of the Safe Group with Sunny Daly from Health Imperatives, and they periodically meet. So I'm surprised that they haven't discussed that. I wasn't familiar with this programming that Health Imperatives is doing.
It's their ACT Teens program.
It is their ACT Teens program, and so.
Oh, yes, we are already part of that. We had mentioned about the Zaya gym. So the Safe Place has been from the start of the ACT Teens group, along with Health Imperatives and several others involved in that. So we each have our own niche, I'll have to say. So Health Imperatives decided to go with the emotional and healthy diet, healthy exercise, to revolve around mental health and how to help the mental health issues that we're currently seeing. The Safe Place went in the other direction and took it to the physical activity. Since we have a personal trainer here on staff as well that discusses that with clients here. So each one, the community school is also involved with ACT Teens. So each agency kind of takes a niche and sponsors a program.
Okay. They had just said that they're doing a lot of theirs Zoom, which was interesting. And I know that they have, and do you work with them on their LBGQT program?
They are part of the PFLAG program that we are involved in as well.
Yes.
Okay, that was my questions. It is a little scary to see that you've had a 30% increase in domestic violence through COVID. That is a big red flag, considering we're just into the beginning quarter that you're telling us about. So that is not the kind of news, sorry, from you. We love to see increases from everybody else in the services they're providing with you. We would rather someday see a decrease in those services.
So would we.
Yeah, right. I know. And hats off to the continued efforts that you have done. Jen, I think that you've been a major step forward in keeping these programs going, and your enthusiasm and your love for what you're doing is shown in everything you do for us. So we are very thankful as a community to have you out there.
Thank you, Dorothy.
And we are very thankful as a board to have Jennifer there at the helm as well.
Yeah, she's pretty cool. And Carrie, I have actually not walked around town because I want to be able to see my grandson for Christmas, and we have quite restrictions in order to do that. But I will make the effort to go in and take a look at the mask off tree to see what was
Thank you.
there.
Thank you, appreciate that.
I'm very, I did have a question, the diaper program. Jen, are you guys still doing that diaper program?
We do. When possible, we will refer to the Family Resource Center as well, but we still maintain diapers and wipes here as well.
Okay. And do you do a lot of work with them?
With the Family Resource Center?
Yeah.
We kind of refer back and forth. So we do quite a bit of work with them. Yeah.
They're an interesting group. It would be wonderful someday for us to, even though they don't ever apply for a grant, to sort of hear what they do.
Yeah.
So just to, if I may add to that, whenever everything shut down back in March, if y'all remember, the grocery store emptied out of everything. For some reason, toilet paper and paper towels, but also diapers and formula. So we actually almost instantly got on board with the Resource Center, because that's one of the things that is their major donation, and they can bring it right over on the boat. So we were able to connect with them to be able to send our clients there for whatever they needed as far as their baby needs, wipes, diapers, and formula. Formula was the big one because the whole state emptied out. So everybody in on the island kind of pulled together to get everybody what they needed at that time. And we still continue.
That's cool. And that your BEAT program, how did that come about?
That was funding through the Community Foundation, their Nantucket Relief Fund. And so it was a brilliant idea that someone there created, and then local human service providers were able to partner with local restaurants. It kind of gave the restaurants a boost,
Right.
and significantly helped the survivors we were working with. It was a huge undertaking, but it was so cool.
That is, I mean, that's a major amount of meals
Yeah.
being given to families. Unbelievable work. I see that Brooke sort of put her finger up. Maybe she had something to say. See, Brooke?
Yeah, just by way of explanation, the meals program started because the folks from the Sandbar or the Whale were providing meals to seniors through Saltmarsh.
Mm-hmm.
And then when things locked down, the Community Foundation took that model and used as a funding model. In other words, the Community Foundation can't write a check to a restaurant. So they partnered with nonprofits who then collaborated in putting together lists of people who wanted or needed a meal. And then the nonprofit they partnered them with restaurants. So there were, I think, 8 or 10 at least nonprofit organizations that had restaurant partners through that crisis period until things sort of started reopening in the summer. And it may well be reinstated this winter.
Yeah, we actually, sorry, Brooke. Yeah, it's actually starting again. We're partnering with the Beat come the beginning of January, and we'll be serving dinners once a week moving forward, starting in January again.
Wow, yeah. On that note, look at what Island Kitchen has done. You know? Oh my goodness, unbelievable. Okay, I don't have any other questions. Is there anybody that has anything that they want to say? No? Okay, Jen, we are, as always, we will be doing our interview process. We're going to do it on your terms. So what we need you to do is reach out to Ann and let Ann know what you're comfortable doing. And then we will set up our interviews for on-site interviews or on-site, you know, whatever it ends up being. Okay? And you can just let us know.
One question I did have, I wanted to get just follow up on a couple of things, including the numbers for the Child Witness to Violence program. Yep. Where do I send those? To Ann, or would you like
Ann, and then she'll send them out to all of us.
Okay, perfect.
Okay, fabulous. With that being said, Linda, thank you for always being there for them. You are an amazing board member.
It's an easy job, actually. We just love the mission, and they carry it out with such skill and professionalism. We just, you know, they're amazing.
And grace. They give it grace.
Yes, absolutely.
So Carrie, Linda, and Jennifer, we wish you a very happy holidays and a healthy one.
Thank you very much.
Thank you.
Stay well.
Okay, thanks for your presentation, and Jen, we'll look forward to hearing from you.
Okay, perfect. Thank you.
You're welcome.
Bye-bye.
Bye-bye. Okay, hi everybody. Does anybody have any questions or comments they want to make?
I'm just going to say it again on the PFLAG. I just would like to know, like, are we sending them, is she sending them money, or are they just sending her somebody to help, you know, is PFLAG just sending someone out here and using Safe Place to go into the schools and do their advocacy? Do you see what I mean?
I do. And I think it sounds like what they're doing is that they've had people trained underneath the PFLAG programs.
Mm-hmm.
And it sounds like what they're doing is providing services. I think she made it clear that they are not giving any financial money to PFLAG.
Yeah.
But we will get that in writing.
Okay.
Is that what you like?
Yes, I think I'd feel better about it. I mean, again, if you even just reading their website, they're full on advocacy organization. So I just feel like it separates them from the other things that we look at. Maybe again, I'm new, Dorothy. So the other things that are given money towards are actual, they're not affiliated with groups who are, I think, very political. I do. I'm not saying that their advocacy for what they want to do here with the groups, I'm not saying that that is not something that the island needs. It's just that particular group. That's what I mean about it. You know, I don't know if I'm making.
I understand what you're saying. I think that advocacy I think what we have to look at is if we're not supporting it in any way financially, advocacy for a group right now that is very under-recognized is extremely important, considering the mental health issues that come with that and the substance abuse that comes after the mental health through the inability to be recognized or understand themselves. Any help we can give them is crucial. So I will look into the political end of this, but it does sound like they're just using programs that help them better educate or advocate for people. And I think that I think a lot of what we do, I think I would say a portion of everybody we give grant money to helps them advocate in one way or another for the programs that they believe in. I'm just trying to say that we have to keep that in perspective, is that I think we do, there is advocacy in everybody's plan or everybody's grant. There's some form of advocacy that occurs.
Yeah, if I hit mute, sorry, it's because I've got dogs.
Okay.
It's been a miracle you haven't heard them yet, but it's more that, I guess, like I said, with that particular group, I just don't see that in the other things that we're looking at, where it's like a specific organization that I think is really known for advocating legislation. So that's all.
Yeah. Okay. Well noted. And we will make sure we get that information for you. Okay.
I mean, yeah. And I'll be honest with you, when they went to my daughter's school, we weren't given a heads up about it. So I didn't know. So she told me about it. That was fine. But I did call the school. And the reason I called them is to say, well, if I want to have another group come and talk to you, can they do that? I mean, not meaning that another group, meaning a group like them that maybe supports something, but also is kind of politically aligned. And of course they're like, no, they don't want to do that. And I said, well, then you just have to know that as a parent, I recognize you're bringing them. And I know school didn't know either. Okay. I know that they didn't. They're trying to meet a need that's there, but it just sticks out to me because of who that particular group is. Not what they're doing, but because of their activism.
Okay. So what bothers you is not what the organization does, but their political views.
Yeah, I can't say that. It doesn't, that's not why I'm on this committee. I'm not trying to impose my political views on them.
No, I'm just asking if that's what I better understand what you're saying is that it's not what they advocate for as far as.
Yeah, I don't think that's really for me to determine. I mean, safe place, they feel like there's a need there. I feel like that's their job to determine where their needs are. I respect that. But because this particular group is so active in Washington, D.C. politics, I don't love that. I don't love that tax dollars go to that. And I realize that's a very small part of what Safe Place is doing. So don't think I would never throw out the baby with the bathwater. But if they write that down, that none of the money goes to the PFLAG, then I'd probably be more comfortable with it.
Okay. Well, we will ask her for that documentation.
Thanks.
Yeah. Anybody else? Oh, Brooke.
Can I just ask a process question that came up earlier? I mean, we say to people you should ask for more money. In the event that there have been fewer requests than there are dollars, does the elimination of Gosnell put us under the total amount, or?
No.
I haven't looked at the math. It does not.
Does not.
Okay.
Not at all. Okay. It's a $24,000. We're still we started about 125,000 above. Okay. The request. The one thing
I had looked at the numbers.
Yeah, just to understand where, earlier, the last time we met, Linda said that the food pantry came in and asked for rental assistance, asked for a certain amount of money, and they asked for, I think, 200. They gave them 250,000. Because we are a grant, cannot give any more money than what is requested. Even if we believe an organization should be getting it, if we believe there is a need, We have had emergency amendments or amendments made to our grant process, but it has been after a great discussion and research as to whether we can allow it. And then, we've had to ask legal, we've had to ask town management. But all in all, because it's a grant is sealed at the number the person requests. And that's why sometimes you'll hear us say, you should ask for more, because we can't give more. And we might see a program and we might look at a program and say, wow, this program didn't really do what they said they were going to do. And they're asking us for this money, but this program, wow, it underestimated what it did and has asked for, not as much money as we would love to give it. We cannot overstep that bounds and give them more money than they've asked for, that's why we try to advocate to people to ask for more, because we can give less, we can't give more.
Okay, that's super helpful. Thank you.
Yeah. And I did ask, this has always been a sore subject with a few of us. So as we're getting ready to go further, most of our nonprofits have not taken a raise in salary in a few years. We have, this has been an ongoing one. I know that it upsets Bert and it upsets me, is that the food pantry continues to get a increase in salary of wages. They are again asking for the cost of living. They're putting in their cost of living raise at 2%. I have reached out to town management, and in any negotiation they're in right now, they are not offering a 2% raise in increase in salary to anybody in negotiations. And in conversations with these other nonprofits that I have had, most people are staying steady and not looking at increases because of the economic times. So I'm just going to put out that out there, because that has been something we have discussed at great length in prior meetings. And I just want to put that out there before we go into our discussions with organizations.
May I?
Yeah.
Dorothy, can I comment on that? I think that this year is unusual for sure, in terms of the COVID situation. I am a little reluctant to expect, in general, employees of nonprofits to not get cost of living increases. And I'm not sure that's what you're saying, but I'm not sure it's an effective delivery of human services if you expect people to work without appropriate, inflation-related, increases in their pay over time, because the cost of living here is so crazy. And so if we're going to support effective human services delivery, salaries are, people will go elsewhere. So I just want to throw that into the mix. And I don't think that's what you're saying, but just as a general philosophy, there tends to be an expectation in the nonprofit world that people should, that the people should somehow expect less in compensation. And there's some folks in the nonprofit theory world who argue quite the opposite, that when you pay well, you attract good people and you actually get more efficient service delivery in the long run. And I just want to throw that out there philosophically as
can I jump in and just back you up there, Brooke? I agree. We've had that at organizations I'm involved in, including the one you met earlier. And the staff took pay cuts this year for a big part of the year. And I'm really grateful that they did that. So, maybe that's something we could ask if you have concerns about that. Like, I can't believe they did that. They did that on their own. And I know other organizations did the same. So, I really, and had we not, been able to take them back to the level that they were comfortable, they would have been recruited. And there were a lot of nonprofits this year, as you saw, that lost their staff for many reasons, I'm sure, but because people are getting recruited away. So I totally just wanted to amplify what you're saying, Brooke. Thank you for bringing that up. Good point.
Bert?
Yeah, trying to wrap this thing up because we're way past that time, I think, aren't we?
No. We have 10 minutes. We have 10 minutes for a break. I know what I'm doing.
Okay. If we do site visits, I put in to do small friends in the food pantry again.
Okay, when we do it, yep. Yes, and Jill and Brooke, I don't think it has to do with, I think our biggest concern over the years is everybody's been very transparent about their salaries except for the rental assistance and food pantry program. And we've had to fight to find out what their salaries actually are. And their salaries end up being a lot more than they project to us. And we have seen cost of living. We're not saying that somebody that does their job well shouldn't be compensated for making a program work. We agree with that. We want more transparency. We want a better understanding of what the actual salary of every employee is.
Oh yeah, definitely.
And the increase in salary and compensation maybe doesn't flow with what is on the broader level of what we're seeing even nationwide right now. So we need to keep some things like that in perspective.
Oh, I'm all for transparency, Dorothy, so no
Yeah,
problem.
and it's been very untransparent for us. It's been it's between that and to be honest with you, up until recently, Fair Winds, it's been a real battle to get information and accurate information. And to get accurate, to get anything accurate, it's become so we believe in the services. We wouldn't be here if we didn't, any of us, right? I can guarantee you that. We all believe in what they do and the impact they have in the community. With that being said, if nobody else has anything to say, I'm going to allow Bert, because he's so quick to want to get out of here, to make a motion.
Motion to adjourn.
I'll second that.
Okay, so can we have a roll call on it? Bert?
Aye.
Jill?
Aye.
Brooke?
Aye.
John?
Aye.
Dorothy, aye. Anne?
Yeah.
Thank you, Anne.
Dorothy, I just want to say I really appreciate how you run these meetings, and it's really effective and thorough, and I just want to say thank you. It's a pleasure to be on this.
No, thank you very much.
This group.
Wait until you see the report that she writes each year. She does it single-handedly.
I've seen her do her presentation at the select board, and it was my first impression of you. It was a very strong and positive impression last year when you came to select board. So I'm excited to be here. Oh, and by the way, Council for Human Services will have on our January agenda appointing a second person. I'm not sure our second person will be available, but I'm told we have to appoint someone. So we may have a person who's nominally serving, but our group, when we did the nomination process, when I was nominated, availability was a challenge for the members who are on CHS. And I've actually talked to Rachel about, there was a technical problem with, we're actually adjourned, right? I'll bring this up next time.
Okay, sounds good. Thank you.
Okay, all right.
Bye, everybody. Stay
Bye.
healthy.
Bye.
Bye-bye.
Bye.
See you Monday.